In this lesson we will be studying about spondylitis. What is spondylitis? Spondylitis is a type of arthritis that primarily affects the spine. It causes inflammation, which can lead to pain, stiffness, and even structural damage over time. By comparing both the healthy and inflamed spine, we can see that the red inflammation occurs in the vertebra. Let's see what happens to the spine. Inflammation occurs in the vertebrae and sacroiliac joints, which connect the spine to the pelvis. Over time, this inflammation can cause the bones to fuse, limiting movement. Types of spondylitis. First, ankylosing spondylitis. Second, reactive arthritis. And third, psoriatic arthritis. Ankylosing spondylitis, also known as spine-focused, causes inflammation and gradual fusing of the vertebrae. It is most common and primarily target the spine. Symptoms: back pain, stiffness in the lower back and hips, especially in the morning, neck pain, fatigue, anorexia, weight loss, anemia, and other. Causes: people with a gene called HLA-B27 are at increased risk. Crohn's disease, ulcerative colitis, or psoriasis can develop ankylosing spondylitis. Reactive arthritis, formerly known as Reiter's syndrome. It is an inflammation of joints, which usually develops after infection. It is sexually transmitted disease or gastroenteritis.
This condition usually targets the knees, ankles, and feet. Its symptoms starts after 1 to 2 weeks. Joint pain and inflammation, swelling of fingers, red, sore eyes, fatigue. Small ulcers in the mouth can occur. It is caused by organism like Salmonella, Shigella, Chlamydia, genetic factor, age, stress, or environmental factors. Psoriatic arthritis. It is a chronic inflammatory condition, which is also known as skin disease. It affects both the joints and skin of people with psoriasis. It causes red patches of skin with silvery scale. Symptoms include joint symptom: pain, stiffness, swelling in hands, skin symptoms, red, scaly, itching, burning sensations, nail symptoms, discoloration or brittleness of the nails, eye symptoms, redness, pain, or blurred vision. Other include fatigue, anorexia, weight loss, fever. Causes include genetics, obesity, smoking, trauma or injury to the joints, environmental triggers like stress, injury. Diagnosis of spondylitis include rheumatoid factor and anti-CCP antibodies. Rule out rheumatoid arthritis as spondylitis does not typically show the markers. Physical exam. A rheumatologist examines your body and discusses your symptom. Complete blood count, CBC. Assesses anemia or infection-related changes. Blood tests. These include erythrocyte sedimentation rate, C-reactive protein, and HLA-B27. MRI. Pelvic/spine MRI may be done in select patients. X-rays. These are used to assess the lumbosacral spine and sacroiliac joint. Erythrocyte sedimentation rate and C-reactive protein measure levels of inflammation in the body. Treatment for spondylitis include NSAIDs like ibuprofen 400 to 800 mg, 3 to 4 times daily, naproxen 250 to 500 mg, twice daily. DMARDS. Sulfasalazine 500 to 3000 mg per day, methotrexate 7.5 to 25 mg weekly. Analgesics. Paracetamol 500 to 1000 mg orally every 4 to 6 hours as needed. Tramadol 50 to 100 mg orally every 4 to 6 hours. Corticosteroids, prednisolone 5 to 20 mg orally daily for short-term use. Methylprednisolone. Injection 40 to 120 mg. Bisphosphonate alendronate 70 mg once weekly. Risedronate 35 mg once weekly. Calcium carbonate plus vitamin D3 500 to 1000 mg, calcium plus 400 to 800 IU vitamin D daily. Non-pharmacological treatment. Drug-related. Long-term use of NSAIDs may cause gastrointestinal irritation or ulcers. In DMARDS, monitor liver function and blood counts regularly. Bisphosphonates, for osteoporosis prevention in patients at risk of bone loss. Corticosteroids not recommended for long-term use due to effects like osteoporosis. Paracetamol or tramadol for patients who cannot tolerate NSAIDs. Calcium and vitamin D supplements that support bone health. Lifestyle-related. Exercise and physical activity, stretching, swimming, walking or cycling. Diet and nutrition. Include omega-3 fatty acids, drink adequate water to keep joints healthy. Stress management, meditation, deep breath, smoking and alcohol. Avoid consumption as it can affect bone health. Weight management. Maintain a healthy weight to avoid additional stress on joints. That's it for today. Thank you.